Good afternoon, everybody. This is Dee Reinhardt with Illinois WorkNet. I am starting our presentation today on our career trends in healthcare. It's our part of our Exploring Careers series, and today our guest speaker is Michael O'Rourke. He is the Regional Human Resources Officer with Presence Health. Thank you, Michael, for joining us today.
Dee, thank you for having me.
What we are going to do today is we're going to talk about career and trends in the healthcare industry, and we're going to start that out today by providing some information to help you with your career search or if you're needing to make a career change and those decisions that you need to do today. So one of the questions that we want to talk about today are what are some of the characteristics of a healthcare personality? But before we get too far, I want to pull those out of the way and let you answer these questions for our audience and let us know what you think the answers are. How are they doing, Michael?
They're doing great.
And we're going to give everybody just a moment to finish up answering these questions. Notice how I hid the answers? All right, we're going to close this poll. So let's talk about what we actually have on our list. What are the things here that's important?
Well, Dee, I think as you look down this list, you can see there are a lot of different characteristics that people in healthcare are really looking for. And I think first and foremost, probably the first thing that needs to be looked at is, does it feel like a fit? Does healthcare really fit into something that you want to do for a profession? And so as recruiters, some of the things we screen for are, is it a position that the individual really believes in, that they want to do? Do they feel it's a calling? Are they, what are their reasons for doing? Is it to give back to their local communities or to help people? But regardless, they need to know that it is a field where they want to work. Obviously, the characteristic of caring speaks to the fact that they're going to be providing patient care to people who need it. And so one of the major characteristics that we look for is somebody a caring person? And are they interested in providing care to those people in need? Being a good team member, I saw it on the list, and it shot straight to the top. And your listeners are absolutely right. Being a good team member is critical, especially in a healthcare environment. Healthcare is really designed to be a team sport, if you will. We have doctors working with nurses, working with LPNs, working with CNAs, and they really function on the floor and in their departments as an operating team. And so while it's good to have somebody who may be technically competent and capable, those soft skills like teamwork and good communications are really critical to be an effective team player and to be successful in the healthcare environment.
In a lot of jobs, Michael, I don't mean to interrupt here, but in a lot of jobs, some people will say if they have soft skills, they can train them for the rest of the skills. Mm-hmm. But that's a little bit less than what they can do in the healthcare field, right?
Yeah, I think that in some careers that you can do that, especially in the area of customer service. I can tell you that most very successful clinical hospital healthcare professionals have those soft skills when they come in. And I do agree to an extent that you can train them, but in our case, most of the training involves a license or a professional degree. So it's a little, it's not quite as easy to say, well, we're just going to train them because, that what's required is a professional degree and a license. But definitely the soft skills are an important part of working in healthcare. And, I talked a little bit about caring. Again, those soft skills are just critical in working with patients.
Right. I like this point on here about being emotionally strong.
Yeah, it's so funny. I actually was rounding and talking to some of the employees, and we had a nurse that came up to me, and he just shared with me, and they'll do this in healthcare. He shared with me just what a difficult night he had. He went from the low of having to deal with a car accident that happened to the high of seeing the patient live through the experience and being okay. And that can happen all in one shift. And so working in healthcare and dealing with patients, you need to be emotionally strong because as much as the emotions are an important part of working in healthcare, and being emotionally strong helps you through those times when there are peaks and lows uh, in your
Right.
shift.
And one of the big points here, especially in healthcare, is attention to detail. If somebody makes the wrong dosage or just does just the wrong thing, it could be critical.
Yes, absolutely. Critical to have somebody who can, spend the time and have that focus and attention to detail so that they're able to document correctly on the medical record. But that detail isn't always just in documentation. It's that attention to detail even in their communication at the change of shift. Having somebody really focus on the details, whether it be in writing on a medical record or when they're communicating at a shift change. Um, you know, those the detail really becomes very important when you're talking about quality of care and providing the best care that you can to the patients.
Right. One thing that I've noticed, I spend a couple of Friday mornings a month at a local hospital, and I've noticed that all of the patient techs and all of the nurses and everybody are all wandering around the halls with laptops now.
Hmm.
Everybody needs to know a little bit about technology, don't they?
Yes, absolutely. The Affordable Care Act has changed all that. Um, with the implementation of meaningful use or the requirement for electronic health records, most healthcare systems in the country have already implemented electronic health records into their day-to-day operations. And for those that haven't, they'll really only have until 2015 to be able to get that completed. So, we're finding that every level of position within healthcare really needs to be able to understand and technology and how it interfaces with healthcare that we're providing today.
So let's move on to the next slide and just talk a little bit more about that Affordable Care Act information that everything is changing.
Sure. Um, well, with the Affordable Care Act, as we all know, it was signed into law in March of 2010. And since that time, healthcare organizations have been preparing for the Affordable Care Act implementation. Actually, a lot of the healthcare organizations in the country began preparation years before the implementation of the law. And so one of the major impacts that we're seeing in healthcare is this implementation of that electronic health record for those organizations that didn't already have it in place. As a result of this, the changes in healthcare that we're seeing today, we're beginning to see less inpatient or acute hospital visits. There's a trend of declining patients in our hospitals these days. And then there's been a significant shift to our post-acute care, which includes areas like medical clinics, home care, and hospice. More and more patients are going away from the hospitals for their care. They're going more to the clinics and doing a lot more care at home.
Yes, I noticed that a lot.
Um, some of the other things that have been changing, there's been significant consolidations in healthcare over the last 4 or 5 years. You probably have seen healthcare systems downsizing and shrinking. And as a result of that, new jobs are being created. Completely different and new jobs and careers are being created as a part of these consolidations. Part of it is that we're seeing them downsize, but the other part is we're seeing a jump in mergers and acquisitions that are occurring across the country too. That some healthcare organizations are purchasing or merging with other organizations to become bigger organizations in response to the healthcare changes. We're also seeing, a shift away from what we call traditional fee-for-service care into more of a value-based care, or what we call a shift to population health management. And really, this is sort of an evolution of healthcare moving toward, that value-based reimbursement for the patient. And by value, we don't mean low cost necessarily. What we mean is that we're giving the best value for the highest quality of care. And so healthcare organizations have really been faced with changing their operations to meet this value-based care. So again, another really significant trend that's been impacting healthcare over the course of the last several years. And so with all these changes that I've just discussed, really, what we're seeing is a huge growth in jobs in healthcare. And so our future really, really looks good.
That's good. I've noticed, so many industries have customer service surveys, and they want to know that I've given you the best care. Well, that's happening in hospitals and the medical field as well now. They're very geared toward making sure that the patients are very happy so that they get great survey results. And I've noticed that they actually pay attention to what the patients say so that they can make some changes for that.
Yes, absolutely. And so patient satisfaction is really going to be affecting reimbursement. The healthcare consumer is changing. They're becoming more aware of the cost of the procedures that are being provided, and they're having more of an impact on the hospitals and how they operate, since they're being measured on patient satisfaction and scores. So, the consumer is really having a greater impact in the day-to-day operations and the changes in healthcare that we're seeing today.
Yes. Let's answer a question from the audience that came in while you were discussing this previous points. How can someone get around the patient privacy laws if they want to shadow someone in the healthcare profession? For example, a surgical tech or a nursing or a radiology tech.
Well, there are still, as you talk about shadowing, that's a wonderful opportunity, but there are also those risks that healthcare organizations have with having somebody shadow. A lot of healthcare organizations will have relationships with universities where the guidelines related to shadowing are very clearly spelled out, and that there is an infrastructure of expectations that are put into place, things like background checks and TB tests and immunizations and liability insurance, so that as people are shadowing and working in that healthcare environment, that they've been checked and that they're healthy, and that we have in fact guidelines set up that detail the shadowing program. So I hate saying it, but there are a lot of rules as it relates to shadowing, but a lot of healthcare organizations have partnered with larger universities with those types of programs and have established contracts. So if you're going to school, a lot of times the school will have partnered with a healthcare organization, and shadowing can occur. Other times it's a little bit more difficult because there are liability issues and risk issues that have to be considered as we're looking at patient care, patient safety, as well as the individual who wants to shadow, their safety too.
Great. Let's move on to the next slide here, and let's talk a little bit about the fastest growing healthcare occupations that we have. You want to run down this list a little bit and talk a little bit more about those?
Sure. The fastest growing healthcare occupations that we're seeing between 2012 and 2022 are in the area of personal care aides, home health aides, which is expected to grow by approximately 48%. And that's in response to, I think, as I discussed earlier, the shift away from, the acute care environment or hospital environment into this post-acute world. And so personal care aides and home care aides are going to experience tremendous growth in the next 10 years. And we're already seeing that growth. Many organizations are already seeing it right now where they're looking for people to fill those positions for them. Rehab careers, has been a wonderful career path for many years, and it's going to continue to be that way in the future. Your traditional rehab positions like physical therapy, occupational therapists are really hard to find, and most organizations still struggle to find people to fill those positions. Now, I can tell you that occupational therapy, at least from my perspective, is a lot more difficult, and there's a greater need in the OT or occupational therapy area. There's also been a trend recently with some of the two-year degree programs, which are experiencing tremendous growth. Jobs like occupational therapist assistants, physical therapy assistants, the physical therapy aides, all of those are really slated to grow in the 40% range over the next 10 years. And so, rehab continues to be a very strong opportunity for professionals who want to have a great career in healthcare. Other areas that we've seen tremendous growth, nursing. You've probably seen it on the news that there's going to be a tremendous a career opportunity in nursing in the years to come. Well, it's projected to grow at approximately 19% over the course of the next 10 years, but that 19% really represents about 500,000 new jobs, and that doesn't necessarily include the nurses that are beginning to retire because they're aging out and want to retire and get out of healthcare altogether. So we're going to see in the area of nursing a tremendous amount of growth, and nursing is going to continue to be that core healthcare position in the future. So again, tremendous growth for nursing. Other nursing degrees would be medical assistants, which is expected to grow at about 29%. A lot of the healthcare organizations are beginning to purchase medical practices that were privatized, or are private in the past and are now being company owned. And so as a result of that, we're seeing an increase in the number of medical assisting jobs that have been opening up, and we expect that trend to continue into the future. So a lot of opportunities with nursing. Interestingly, though, with RNs, they're also taking on new careers. They're working in jobs as nurse practitioners. So instead of just providing bedside care, they may be working in a clinic under the supervision of a physician, providing you care when you go in to visit the doctor. My own personal physician is actually a nurse practitioner, and she's under the supervision of a doctor. And so that's been a tremendous trend that's increased over the last 4 years.
Well, what I've seen too, Michael, are some of the drugstores like Walgreens or CVS have the like minute clinics or the drop-in clinics, and those aren't those like nurse practitioners as well?
Absolutely. It's so funny because when we talk about competition in a hospital environment, our competition isn't the other hospital down the road. It's going to be the Walgreens minute clinics. And you're going to continue to see growth in those minute clinics, whether it be for Walgreens, for Walmart, and other areas. You're going to continue to see that trend with these clinics beginning to pop up. And so there's tremendous competition in this arena because that's really the direction where healthcare is pointing. And those nurse practitioners are going to play a key role in staffing those clinics.
Yeah. Let's talk a little bit about this healthcare information technology.
Yeah, healthcare information technology is, we talked about the Affordable Care Act being implemented in 2010 and the fact that employee health records, or electronic health records, I should say, are being have to be implemented by 2015. Well, as a result of that, many organizations over the last 4 years have been implementing electronic medical records at their sites. And so IT growth and opportunities have been going through the roof. And it's in the area of meaningful use, which I talked about. And meaningful use isn't just the implementation of electronic health record. It's really implementing the electronic health record to improve the quality and the safety and the efficiency of the care that we're providing to our patients. So there's data analysis that's involved with that. Some of the other IT growth areas are in the areas of mergers and acquisitions that are occurring in healthcare. You know, we're integrating technologies from different companies that are merging or companies that are consolidating and going into a single enterprise resource planning platform to help communicate across the different clinics and hospitals. ICD-9 coding is another area where IT is playing a key role as we switch from ICD-9 to ICD-10 coding. And then there's a lot of internal training with these electronic health records. And so as a result of that, we've seen several key IT jobs begin to surface. System analysts, project managers have been very important, especially as we've implemented these electronic health record programs. And then, of course, healthcare informatics, which we talked about earlier as being that blend between computer science and those clinical professionals like nurses or physical therapists. And so as we look for people in the future, some of the certifications that we're looking for in the future are going to be certifications like a Bachelor of Science in Nursing. You know, we're not just looking for that computer science person anymore. We might be looking for a computer science person who has that Bachelor of Nursing or is a physical therapist to provide that clinical aspect to the IT component that we need to implement. Other certifications include basic certification with A+, which is for coding, and then desktop support in IT. There's been a tremendous amount of growth as IT has expanded across the healthcare system. And then certifications in Epic applications, which is considered to be sort of a gold standard in electronic medical records. I can tell you about 2 years ago we implemented within our own organization Epic, and we saw some consultants coming in at over $200 an hour working for our organization on a consulting basis because they had those Epic applications at the right time. And so what we've seen is this tremendous amount of IT growth over the last 3 or 4 years, and we haven't really been able to respond adequately to fill those positions, and we've had to go to consulting groups to find replacement people to help us implement this new technologies that are being implemented. So IT is just has been and will continue to be a very important area in healthcare and will continue to grow in the future. Hello?
Hi, we've got a couple of questions from the audience about what is ITD-9, ITD-10, and EPIC. What do those all stand for?
Okay, well, EPIC is a electronic medical record program. It's actually a company that has that owns. They own a company that has an electronic medical record program, and it's, as I had mentioned earlier, it represents the best electronic medical record in the country at this time. So when you look at Epic, you think of an electronic system or a software system, and that's what Epic is. And like I said, the Epic degree or application certifications have been tremendous. So ICD-9 and ICD-10 is the method for coding that we utilize in medical records. It's an acronym for the International Statistical Classification of Diseases and Related Health Problems and Revision. And so the healthcare industry in the United States is going through an upgrade where a lot of these different coding systems are beginning to change. Most of the other countries in the world have switched to this new coding system, which is ICD-10. And so the United States is going to be going through that transition in the future. And so as a result of that, it's going to change the coding systems that we currently have in place to this new ICD-10 coding system. And so as a result of, the changes and movement toward this new coding system that we utilize, we're going to see IT opportunities in support of the implementation of this new coding structure that's going to be implemented. I hope I
All
gave a
right.
good answer. Is that okay?
That explained it for me because I was kind of wondering what those things were as well.
Okay, I'm
An-
sorry.
Not a problem. An article that I found, it mentioned the 38 best healthcare jobs of 2014, and top of the list was dentist, then followed by nurse practitioner, pharmacist, a registered nurse, a physical therapist, a physician, dental hygienist, physician assistant, occupational therapist, and a phlebotomist. So that's making not just hospital workers are there, but we've got some other jobs that are available. And then another article that I found was in the past decade, it was from Career Realism, in the past decade, the healthcare utilization rates showed us how services have changed. Even with an aging population and healthcare incentives, there was not much increase or decrease during a 10-year span for visits to the hospitals, physician's office, or emergency room departments. But there's an increase in outpatient branches, and I think Michael already alluded to that, is that we're shifting away from everybody just going to a hospital, but they're trying to get the best care for the best value. And I
Hmm.
think that's one of the things that we need to look at is it's not always going to be a hospital anymore, but that's where you're probably going to get the most comprehensive care. Um, what I would like to do right now, to be mindful of everybody's time, is move on to what are the best ways to stay updated in the healthcare field. So if you'd like to talk a little bit about the points that we have up on the screen, Michael, we've got a whole career cluster of information that you can find at ONET. But then what about organizations or publications?
I think, as you had indicated, ONET is a great resource. And then, I think professional publications and associations is where a lot of the professional clinicians go to stay abreast of changes within their own specific discipline and their own specific career. So that's always a tremendous place to get new information about what's going on and what's the trend in healthcare. So I think the association information is critical for staying abreast of the changes. Another area that I like to go to, and I'm in human resources, if you're talking globally about changes, is the Bureau of Labor Statistics. I do like to see the trends that are occurring in healthcare, but also I always like to look at the wage trends. A lot of times with the wages, if you begin to see wages begin to increase, it's a sign that there's going to be an increase of need or within that particular profession. So the BLS is also very helpful in staying abreast of changes and trends within healthcare.
And just so that you know, Michael, one of our earlier webinars was on labor market information. And so if any of our audience wants to go back and watch that one, we actually had one of our labor market experts from Illinois talk about how they can use the data that they can find to find out what the hiring trends will be in healthcare or any job, as
Mm-hmm.
well as the wage information that they can find.
Mm-hmm.
And if we can find that link, maybe if Lacey's listening and she can find that link for that webinar, if she can add that into the chat pod for us, I'd appreciate it. So what about networking? We've got a networking point on there.
Yeah, I think social media and joining groups. If you're part of LinkedIn, it's a great way to network and join a group, chat with friends about even Facebook about different areas of healthcare that you have interest or that you want to stay abreast of. You can join in conversation. So that's a great way to stay in tune with what's going on in healthcare. Networking with friends is always a great way to stay in tune with the trend changes. If you have people that you know that are in healthcare, talking with them about what's going on in their area. I've got friends all over the country that I call and talk with that are in different parts of the country, and we compare notes on what the trends are in the different regions of the country related to healthcare changes. So that's a great resource. And then ask questions and taking an interest is always a great way to stay in tune. Just asking questions and finding, from either friends or coworkers or even from people in the healthcare industry that you're familiar with is a great way to find out about what's going on too.
Right. I like that. A lot of times networking with people is the best way to do anything. And again, if Lacey could find the link for the labor market video that we had and put that into the chat pod, that would be absolutely wonderful. All right, I see one person typing, so we'll give them a chance to ask their question if they would like to. But right now I would just like to thank Michael O'Rourke from Presence Health for joining us again today. It was a wealth of information, and he really had some great information to share with everybody about uh, career trends in healthcare. And it's just really great information. Is there anything else that you would like to share with the audience right now before we close down our session for today?
No, Dee, I think I've shared everything.
All right, great. Well, thank you, everybody. Watch for the posting on YouTube and on our website for all of our career trend webinars that we've had today. We do have one more scheduled for Thursday that is about finding out what your best career path might be. So thanks again to Michael O'Rourke from Presence Health. We will be posting this webinar along with all of our other ones, and we hope that you join us for future webinars. Thanks to everybody, and have a great day.